Hello, I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us. Going to have a conversation in this segment with returning guest, Dr. Amanda Sheehan. She's joining us to talk about digital smile design. It's a software recently created in Brazil, and this software allows patients to see how their new smile can look through the use of photos, videos, and temporary mock-ups. Welcome back to the program, Dr. Sheehan. How have you been?
Oh, I've been great. Thank you so much for having me.
Great. Well, for our listeners who may not be familiar with you when you were here with us before, a brief background.
Well, I'm a general dentist. I practice out in Waterford. I have a special focus in cosmetic and reconstructive surgery, basically bringing comfortable and confident smiles that fit people's faces.
Now, when someone has an accident or maybe they've just got some really some bad things going on in their mouth with their teeth, dental restoration procedures are common for these types of people. You know, accident, maybe an illness or something like that. Talk about digital smile design.
So obviously we see during these days that we've seen a lot of things are going towards technology, right? In the past, we used to take impressions and build teeth with wax in the back and duplicate that and make those into teeth and crowns. Now we design everything on the computer from start to finish. The days of the putty where people gag on having to have this in their mouth are over. Mm-hmm. Now we use a recording machine, a video machine that we take that accurately captures the patient's mouth, teeth, gums, so we can actually start to design the smile on the computer. Mm-hmm. Once we import it into the computer, we can actually use different templates to start to simulate what the smile would look like. Now, we've been doing this for quite some time, but the new advancement is that we're now matching it to people's faces. So we import and merge the technology from your mouth, including the 3D technology of your face and head, and actually can design a smile that's literally your mouth on the computer. Once we've done that, we can actually print out the mock-up and try it directly in a patient's mouth.
They're going to look exactly like the smile that's in the mock-up. Sure, there was a lot of, blind faith before. Is this something that's absolutely, positively accurate as far as how it's going to look?
So the best part about computers is you can copy and paste. Mm-hmm. So when you say exactly, well, when we do the mock-up, we're trying it over somebody's existing teeth. Okay. So if your teeth are small and we're trying them in and we're making your teeth larger because that's more appropriate for your face, mm-hmm. then yes, it would be exactly like your permanent. But, you know, sometimes somebody needs a reshaping of a tooth. And so when we try it on, it's not going to be exactly until we actually make what's called an additional mock-up, which will be exactly. But the whole concept is that we can design, the patient can actually have an active role in this now too, because we can design the smile, we can try it in, and they can say, well, I think I want this more round, or I think I want this more square. And truthfully, they can see themselves on the photo and in the video and can everybody else see. They move their head around left and right. It's really quite amazing to see people's reactions as they see this, transpire right in front of them.
You know, you talked about putty and wax and patients gagging because they had to have this mold or whatever in their mouth. What about the time that it takes to have a cosmetic procedure done? It's not something that you're in and out. Does it cut down on the time that normally would take to get dentures or start an implant procedure?
Oh, it absolutely does, because we've already worked out all the fine details of the case on the computer. In the past, we would get it very close. You know, we waxed everything up. We would say, okay, this is, going to be what we're going to be putting in the mouth, but there's that human element of error, from pouring up a model, mounting that case, transcribing it from from the analog into the patient's mouth. That doesn't happen anymore because, as we're all aware, computers don't really make mistakes when they're printing things. So there's so much less time involved in it because there's a lot less error involved in that.
And as far as irritation, as far as having to use, I don't even know if they even use adhesive anymore. Is that something that is diminished based on this advanced technology that more properly fits dentures and implants?
Well, I think my prediction is in 5 years, people aren't going to be wearing dentures anymore because it's just cruel and unusual punishment to give somebody a set of plastic teeth and expect them to be able to chew and eat anything that's remotely healthy. So I'll start with saying that. The second thing is with the advancement of the technology and the CBCT, that's the three-dimensional X-ray that we take before we plan implants, is that we know the bone quality prior to getting in for surgery. Mm-hmm. In the past, when we would go in, we would be able to have a general idea of what the bone would look like, but you didn't know until you put your hands in somebody's mouth and you actually started putting the implants in. And that would change the treatment plan all the time. Mm-hmm. We don't have that problem anymore because we can tell how strong is the bone, how dense is the bone, where's the nerve, where's the artery, what's the proper size we need to use, what's the proper protocol we need to do. Because depending on, bone can be anything from styrofoam to maple. So you can imagine there's a wide range of stability in the bone. And I know that now because we have this technology before we even start surgery. So my implant surgery is 25% of the time that it used to be.
When someone has to have a root canal right in the front of their mouth, they're usually not comfortable with having a gap or maybe two missing teeth right there. Dentists kind of craft those replacement teeth for you. You come back in a couple of weeks or whatever. Is this technology used for that as well, or is it for major cosmetic surgery?
Oh no, it's used for that as well. See, the beauty is, the most difficult thing to do in smile design is to get the two front teeth to match. Mm-hmm. Okay, you need a very talented ceramicist who can, do all the fine details with the color and with the shape and all of that. Now with the computer, we make a mirror image and we copy and paste. So there's no, this looks off a little bit, or, because they're identical. And so that really is one of the greatest advancements, especially for, the permanent smile, but for temporaries too, because we can print off the temporaries and they just look far more natural because, we're not sitting there carving them. It's already printed out. We've already decided exactly the shape that we want based off the patient's smile and how their face looks. So we design the optimum shape and design for them.
Does the efficiency of this process and this technology trickle down significantly into savings for the patient?
Oh, absolutely. Anytime we are able to do something in-house in the office where I don't have to, have a technician, or if I don't have to go and buy a product and I don't have to do all that, of course it does, because the less time in a chair, time is money for everybody, right? The less time in the chair, less visit. That always leads to cost savings for patients. And of course, anytime you're getting any sort of major reconstruction or even a simple crown done in your mouth, there's always the opportunity to have a problem or some error. Having the technology with the digital designs greatly decreases the chances of these things happening. And the fit of the crown and the fit, it's just so much more predictable because, again, you're not having these putties and the shrinkage from the mold setting and all of these other things that we've dealt with in the past where we've introduced different steps into our lab processing to account for this shrinkage and this expansion. It doesn't exist anymore because we print the exact replica of what's in somebody's mouth. There is no change.
In the instance where a young person who's still growing has an accident or an illness that requires replacement, does the technology take into consideration that a person is going to be growing?
Well, that's going to take the operator to be acknowledging who is the patient that we're working on, right? Because the computer is only going to know what they're putting in. So we have to, as the doctor, be able to design that appropriately. But, there was something you were talking about accidents. So I want to be a little bit more clear about why we're doing these kinds of things. Mm-hmm. Every patient that comes into the office, we do what's called a dental health scan. We take a three-dimensional record of their mouth. So in the past, people took putties if they needed some work. Now everybody. When you get your x-rays, you also get a three-dimensional scan, which becomes part of their permanent record of where their teeth are positioned, where their gums are, the shapes of their teeth. God forbid something happened to them and they got into an accident and destroyed their smile. We would be able to pull back exactly what their smile was and replicate it like nothing ever happened. And further, as people start to have some wear and changes in their teeth, we hear very often middle-aged people say, God, my teeth used to be so beautiful when I was in my 20s. My daughter, she has the exact smile just like mine. And we get what's called a smile donator. You can actually scan it could be a family member, it could be a celebrity, and say, those are the teeth I want to have for my smile. And we can digitally grab their smile and use that in the presentation for the new patient.
Wow.
It's actually quite amazing because there's a lot of, love for family members when a mother can have their daughter smile or something like that.
Where can we go and get some more information?
If you'd like to get more information, we're at oaklandfamilydental.com.
oaklandfamilydental.com. Amanda, thank you again for coming back and joining us. Always a pleasure.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Amanda Sheehan, returning to talk with us about digital smile design. Transcripts and audio of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.